Dear students, are you all rested? Let's continue our experiment. Last class, we have observed the adrenomimetics agents' effects on blood pressure, and we have done the third operation on our rabbits. And let's go over the steps of the experiment, and then we will go on with the rest of our experiment. Okay, this is the fourth group of students
located in the outer part of the ear.
in our class to do the experiment. Let's look at it together.
Cut off the rabbit fur along the vein.
Yes, at first they cut the ear hair. Okay.
Squeeze the vein with fingers to feel the
And
pressure.
then they find the ear viners and inject urine.
Superficial, so pay attention to the inserting point. In order to inject smoothly, fix the needle handle with fingers. Pay attention to the first quick back slow injecting speed. Cotton ball is used in compression hemostasis after injecting. Corneal reflex has been significantly weakened or disappeared at this point. The muscle strength of limbs decrease the neck in the U-shaped eye in the lower part of the first joint of the forelimb. The bent scissor. Make sure the scissor works on the root of the hair. Surgical site is in the middle of neck. Lift the bilateral skin along the middle of the neck using hemostatic forceps. Cut a small opening along the middle of the skin. Separate subcutaneous tissue with hemostatic forceps. Inspect the skin of the neck. The length of the neck is about 5 to 7 centimeters. Lift the subcutaneous fascia with hemostatic forceps. Cut the hyaline tissue. Separate the rest of the tissues with blood separation. compose the trachea. This is the common carotid artery. This is the vagus nerve. Separate the vagus nerve. Place one thread around the nerve in reserve.
我这儿，
可以，
下拉，打标记，
可以做标记。
打点，正常，
normal
别记住血压。
OK， 然后你把注射器拿起来，然后给我看一眼。EP。
epinephrine，
OK。
这应该给多少啊
0.1。Okay, just now we go over the steps of the experiment, and let's go on with our rest of experiment. And just now we have following drugs should be injected after tracing a segment of normal blood pressure curve. We have observed the change of blood pressure curve, and just now we recorded it. So let's inject the drugs and let's observe the effects of adrenomimetic agents on blood pressure. At first, let's inject 0.01% adrenaline, and the body weight is kilogram. We give 0.1 milliliter. So just now our rabbit 2 kilogram. So we inject 0.2 milliliter adrenaline, and then observe the effects of no adrenaline. Okay. After we inject adrenaline, and later the second drug is no adrenaline, we will intravenously inject no adrenaline, 0.1 milliliter each kilogram. And the third drug, we will observe the isoprenaline. We have known isoprenaline is the beta receptors agonist, and we will observe the isoprenaline's effect on blood pressure. We give isoprenaline. The dosage is 0.05 milliliter each kilogram. So we will give these three adrenomimetic agents one by one. Okay, let's do the lab. 它2公斤0.2，生理。Just now we have traced the normal curve. So here is the normal blood pressure curve. And then we will observe the first drug, epinephrine, adrenaline's effects on blood pressure. Adrenaline should be injected rapidly, intravenous injection from the scalp acupuncture injector. And then inject normal saline after administered adrenaline, so that the adrenaline remained in the scalp acupuncture could be rapidly carried into the blood pressure. Okay, here is the normal curve, blood pressure curve, and just now we inject epinephrine adrenaline, and In several seconds, you can find the blood pressure increase obviously, and we observe the effects of adrenaline on blood pressure. Increase blood pressure. Okay, increase blood pressure, and then the blood pressure turn into normal. And let's inject the second drug. The second drug is no adrenaline, no epinephrine. Each kilogram 0.1 milliliter, so 2 kilo we inject 0.2 milliliter no adrenaline. No adrenaline, just now we inject very fast. After inject no adrenaline, and we inject normal saline after administered noradrenaline, so that the noradrenaline remainder in the scalp acupuncture could be rapidly carried into blood circulation. And this is the normal curve. Administration must be after the blood pressure curve induced by the previous administration doesn't change anymore, and we inject the second drug. Thus, now we inject the second drug is no adrenaline, no epinephrine, no adrenaline. And in several seconds, you can find blood pressure is increased hugely. No adrenaline. This is normal. No adrenaline, increased blood pressure. Okay. So thus now we observe the alpha beta receptors agonist. Adrenaline can increase blood pressure. And we also observed noradrenaline alpha receptors agonist also can increase blood pressure hugely. The third agonist is the beta receptors agonist isoprenaline. So isoprenaline, let's inject isoprenaline. Should be injected rapidly. Okay. After inject isoprenaline, inject normal saline, so that the isoprenaline remained in the scalp acupuncture could be rapidly carried into blood circulation. Okay, let's mark the isoprenaline. And after we inject isoprenaline, blood pressure unchanged or a little increase or reduce. Because we know that now in the beginning of the lab we have explained isoprenaline on one hand can excite heart, so increase blood pressure. But on the other hand, isoprenaline also can activate a beta-2 receptor, so also to reduce blood pressure. The total effects may be increase, maybe reduce blood pressure. Okay. Just now, we do the lab. We observe the effects of adrenomimetic drugs on blood pressure. We inject adrenaline and inject noradrenaline. Both of them can hugely increase the blood pressure. And we inject isoprenaline, but the blood pressure unchanged or a little increase. Okay, let's continue the lab. Let's observe the effects of alpha receptors blocker on the action of adrenomimetics. We have explained we studied alpha receptors blocker. The drug is phentolamine. So later, we will use 1% phentolamine to block alpha receptor. The drug's dosage of phentolamine is 0.5 milliliter each kilogram. So our rabbit above 2 kilogram. So we give 1 milliliter, 1 milliliter phentolamine. And we use this drug. We use adrenal receptors blocker through the slowly intravenous injection. And after we use phentolamine, and then we have known blood pressure will be decreased by phentolamine. And 3 minutes later, why we should wait for 3 minutes? Because phentolamine in blood circulation needs 3 minutes to block alpha receptor. So 3 minutes later, alpha receptor be blocked, and then we inject the following agents. So 3 minutes later, alpha receptor be blocked. We inject adrenaline again. 0.1 milliliter each kilogram, and we give 0.2 milliliter adrenaline to observe the adrenaline's effects on blood pressure. Why? Because that's how we block alpha receptor. And then we also give the second drug, norepinephrine, and we also block the alpha receptor. So noradrenaline can increase or decrease the blood pressure. We don't know. Later we will observe. And the last one, we repeated use isoprenaline, the same doses, 0.05 milliliter each kilogram. And we will observe isoprenaline's effects again. And that's now we block alpha receptor. So let's observe the alpha receptor be blocked, and we give beta receptor agonist isoprenaline effects on blood pressure. Okay, let's do the labs. Let's continue our experiment. Let's give alpha receptor blocker phentolamine. Okay, so this is the phentolamine. It is the alpha receptors blocker. Inject phentolamine from the scalp acupuncture injector, and a little slowly injection, intravenous inject. After inject phentolamine, change the injector into normal saline. Inject normal saline after administered phentolamine, so that phentolamine remainder in the scalp acupuncture could be rapidly carried into blood circulation. And that's now this is the normal blood pressure curve. And that's now we inject phentolamine. Okay, so we can see the blood pressure compared to normal curve, blood pressure be reduced. And the phentolamine is the alpha receptors blocker, and block alpha 1 receptor, vasodilation, and then blood pressure be reduced. So let's wait 3 minutes. Just now I explained, we wait 3 minutes to block alpha receptor, and then we repeated use adrenaline, noradrenaline, and isoprenaline again. Just now we have wait for 3 minutes to block alpha receptor, and then we repeated use epinephrine, adrenaline again. So epinephrine each kilo 0.01, and we give 0.2 milliliter, and rapidly intravenous injection, and then use normal saline. Carry the adrenaline into the blood circulation. And that's now we in the first step we have known adrenaline. After we inject adrenaline, blood pressure increased hugely. But this we just now inject noradrenaline, a little increase blood pressure, but then reduce blood pressure. Do you remember you have studied one definition is the adrenaline reverse? Why? Because we use alpha receptor blocker 分出拉明 alpha receptor be blocked, though we give no adrenaline, and adrenaline couldn't increase the blood pressure again. Let's give the second drug. No adrenaline, alpha receptors agonist. So intravenous inject rapidly, and then use normal saline. So that no adrenaline in the remained in the scalp acupuncture could be rapidly carried into the blood circulation. No adrenaline. In the beginning of this part, we have known hugely increase the blood pressure. But just now we inject no adrenaline. But the effects are not very obviously couldn't increase blood pressure. Here is the normal blood pressure, and we inject a normal adrenaline. Because we have inject alpha receptors blocker, so we give repeated use adrenaline. Only increase blood pressure a little. Compared to normal blood pressure curve, no adrenaline, no increase blood pressure a little. The third alpha beta receptors agonist, isoprenaline. Alpha receptor be blocked, and now beta receptor be excited. So isoprenaline, both of these effects, isoprenaline, total effects of isoprenaline, no use, couldn't increase blood pressure again. Okay. Just now we observed the effects of alpha receptors blocker on blood pressure, and we also observed the effects of alpha receptor blocker on the action of adrenomimetic drugs on the blood pressure. We give adrenaline. At first, we block alpha receptor, and then we give adrenaline, no adrenaline, isoprenaline. Though can increase blood pressure, but only mild increase blood pressure. And the next step, let's block beta receptor. So let's observe the effects of beta receptor blocker on the blood pressure. We give propranolol. It is the unselectivity beta receptor blocker. The dosage is 0.5 milliliter each kilogram. So 2 kilogram, we give 1 milliliter propranolol, slowly intravenous injection from the scalp acupuncture injector. And then you can find beta receptor be blocked by propranolol. Blood pressure be reduced. 5 minutes later, why? 5 minutes later, beta receptor be blocked. We repeated use adrenomimetic drugs again. So we repeated use adrenaline, no adrenaline, and isoprenaline. Same doses, adrenaline 0.1 milliliter each kilogram, and no adrenaline 0.1 milliliter each kilogram. Isoprenaline, the same dosage, 0.05 milliliter each kilogram. Let's observe the effects of beta receptors blocker on the action of adrenomimetics. So later in this step, we observe propranolol's effects on blood pressure, and then we observe beta receptor blockers effects on adrenomimetic drugs. Okay, let's do the lab. Okay, let's do the lab. Let's inject a beta receptors blocker, propranolol. So propranolol 0.5 milliliter is kilogram. So we give 1 milliliter propranolol, slowly intravenous injection from the sculpture. This injector, slowly injection, and then use normal saline. Make sure the propranolol flow into the blood circulation. After we inject propranolol, and you can find the blood pressure will be reduced, slowly reduced. So we inject propranolol, and you can find blood pressure reduced. Okay. And after we inject beta receptor blocker, and let's wait 5 minutes. Let's wait 5 minutes. And then we repeated use adrenaline, noradrenaline, isoprenaline again. Okay. So that's now we have inject drugs, all drugs, alpha beta receptors agonist, alpha beta receptors antagonist. So we have finished our lab and stopped the computer. Stop the computer. Stop the computer and don't forget save the document and find your document in this system. So this is that's now we do the lab. Do you remember? We trace the curve, normal curve, blood curve. Here is the normal. And then we give adrenaline, epinephrine, increase blood pressure. And then we give noradrenaline, also increase blood pressure. And then we give adrenaline, noradrenaline, isoprenaline. Copy this curve. And we use this one, data cut. This is the noradrenaline curve. Data cut. And then we give isoprenaline here, a little increased blood pressure. So we need some curves. And don't forget data cut. And we give phentolamine alpha receptor blocker. Okay, reduce blood pressure. We need the several curve. And we give adrenaline repeated use. Data cut. A little increased blood pressure. And then we give noradrenaline repeated use. A little increased blood pressure. Data cut. Okay. And then we give isoprenaline. Where is isoprenaline? Here. No use. Okay. And isoprenaline. Cut this curve. And we give alpha receptors blocker. Just now, phentolamine. And this is a propranolol. Okay. And reduce the blood pressure. save the document. And in this system, open your cart document, and you can find your blood pressure curve. So, blood pressure curve. Copy this blood pressure curve into the Word document. Because this document in this biological system, so open a Word and copy this curve. Because in fact, this experiment, you should write and hand in the report. So in the hand in the report, the report includes several parts. The first part objective, and the second part is steps. The third part results. So in this experiment, and if you hand in your report, you should draw the curve, and you should hand in the curve. Just now we copy the curve, so you should print the curve and put this curve into your report book, and I can know your result. Okay. This class we have done the lab, and we observed the adrenomimetic and adrenal blockers effects on blood pressure. Some notice. The first notice, adrenomimetics should be injected rapidly, while adrenal blockers should inject slowly. Yes, we have injected like this. The second one, inject normal saline after administered the drugs so that the drug remained in the scalp. Acupuncture could be rapidly carried into blood circulation. Yes, that's now we have done this. Follow with this principle. The third one, administration must be after the blood pressure curve induced by the previous administration doesn't change anymore. Yes, we inject drugs after the blood pressure normal, and we give the drugs one by one. The last notice is inject adrenomimetic drugs in time after using blocking agents. Yes, we inject phentolamine and then we wait 3 minutes. We inject adrenomimetics, repeated use. And after we inject propranolol 5 minutes, and we inject adrenomimetics drugs in time. Okay, so just now we did the experiment and we observed the drugs effects on blood pressure. This is the first group's blood pressure curve, and this is the second group's blood pressure curve. So let's describe and record the blood pressure curve again. Just now in the first group, we trace the normal curve, and then we give adrenaline, and we found blood pressure is increased, and then blood pressure turn into normal basic line, and then we give norepinephrine, excite alpha receptor vasoconstriction, blood pressure increase, and then blood pressure to normal, we give isoprenaline. Isoprenaline effects on blood pressure, no use or a little increased blood pressure, and the normal blood pressure. We give this one is phentolamine alpha receptor blocker. After we inject phentolamine, and we found the blood pressure reduced, and then we wait 3 minutes. Do you remember? We wait 3 minutes. Adrenaline, a little increased blood pressure. And noradrenaline, a little increased blood pressure. Why? Because alpha receptor be blocked by phentolamine, and isoprenaline no use. And the last drug, the last blocker is propranolol. This is propranolol. We inject propranolol or reduce the blood pressure, and we give adrenaline, noradrenaline, isoprenaline again. Couldn't increase the blood pressure or increase blood pressure, but a little increase blood pressure. Okay, this is the third group's curve, blood pressure curve. This is the fourth group's blood pressure curve. Okay, and the experiment is done very carefully. So thank you for you did the labs. Okay, and let's summarize. This class we studied alpha and beta receptors agonist adrenaline, and alpha receptors agonist is noradrenaline, and beta receptors agonist is isoprenaline. We observed their effects on blood pressure, and we also observed alpha receptors blocker. The drug is phentolamines effects on blood pressure. And we also observed beta receptors blocker, propranolol's effects on blood pressure. Let's we trace the normal curve, and then we give adrenaline. We found increased blood pressure, and we also give noradrenaline, and noradrenaline also increase blood pressure, and excite alpha and beta receptor. Isoprenaline no use. Okay, isoprenaline no use. And then we give this is normal. Okay, normal. We give phentolamine, and we found phentolamine reduce blood pressure. Phentolamine reduce blood pressure. And we give adrenaline again, a little increase blood pressure. And we give noradrenaline repeated use. Yes, can increase blood pressure, but only a little increase blood pressure. Isoprenaline no use. And the last part, we give propranolol. It's normal curve, okay? We give propranolol, and we found propranolol can reduce blood pressure. And then at last we give adrenaline, noradrenaline again, a little increase blood pressure. Okay, so just now we summarize the labs, and you should observe the curves in your lab, and we observed adrenomimetic drugs and non-adrenomimetic drugs effects on blood pressure. And 3 questions. The first question, how to test the blood pressure? Yes, we use this class. We use 2 hours observe the blood pressure. You have known at first, insert the cannula and observe the blood pressure, give drugs one by one. The second question is the effects of adrenomimetic and anti-adrenergic drugs on blood pressure. Just now we did the lab, and we reviewed, we summarized the effects. Okay, next one. The last question is, if we use some antihypertensive drugs to treat hypertension, such as phentolamine to treat hypertension, maybe induce the drugs overdose, induce hypotension. So the drugs induce hypotension. We use which drug? Which drug can be used to treat hypotension? Adrenaline? No adrenaline. Okay, H is your homework. and think over this question. Which drug can be used to treat hypotension? Adrenaline or noradrenaline? The answer is noradrenaline. Okay, class is over. See you next time.